Hi, my name is Lucia. I'm a nurse practitioner student. I'm going to do a physical exam of the head, ear, eyes, nose and throat. A respiratory exam which includes the lungs and the thorax, as well as a cardiovascular exam which includes the peripheral vascular system. Before I begin the exam, I'm going to wash my hands or use an approved hand sanitizer. We'll begin the exam with an examination of the hair, the face. Beginning with the hair, I would look at the distribution of the hair and also check for hair loss, if there is any pattern of hair loss. I will also look at bald areas, if there is any. I will palpate the head for tenderness while asking the patient if anything hurts. I will also examine the scalp by distributing or opening the hair up to look at the scalp for dandruff or lesions or any protruding area or dents. Then I will palpate the head and also trying to focus the palpation exam to the suture lines like the occipital and the parietal suture. I will go further to look at the face of the patient. While inspecting the face, I'm going to check and see if there is evenness in the color distribution. I'll check for facial symmetry, which in this case is symmetrical. I will also check the skin for temperature and skin turgor. Also check for lesions, and of course the patient's skin is warm and dry and intact with no skin breakdown anywhere that I can see so far. The next part of the exam, we will move to the inspection of the temporal arteries and also palpation of the temporomandibular joint. So I'm going to inspect the right side of the temporal artery for pulsation, and I'll move over to the left side and assess also for pulsation. Then I will check the temporomandibular joint, which is located right in front of the tragus, and then I'll ask the patient to open his mouth. I can feel my finger move into the joint space, and there is no crepitus or any clicking sound. From this part of the exam, I'm going to examine the eyelids, the eyes rather, which includes the lower and upper eyelids, the conjunctiva, the lacrimal duct, and the sclera. So first of all, I'll ask you to open your eyes for me really wide, and I can ask you to move your eyelids, your eye up, both eyes, yeah, down, left, and right. Very good. Then I will use my flashlight to assess the size of the pupils. I'm going to measure the pupil size with my measurement gauge. I will also check the pupils for reaction to light, direct and consensual reaction. So the first part of the exam is measurement of the pupils. So pupils is about 4 millimeters, equal on both sides. And then I'm going to check direct reaction to light. Good. Very brisk. Very brisk. And then I'm going to do consensual reaction to light. Lift up your eyes and look up, sir. Wonderful. So there was brisk reaction when the light is focused on the left eye. At this point in time, I'm going to look at the sclera and the conjunctiva So the sclera should be almost white. It is in this case. Good. I'm going to reveal the lacrimal duct right there. And conjunctiva is nice and pink on the left and the right side. And the next part is the fundoscopic exam. I'm going to do with my ophthalmoscope. Ophthalmoscope. I am going to check the fundus. I'm going to do a fundoscopic. I'm going to do a fundoscopic exam. When I use the ophthalmoscope, I want to look for red reflex. And if I don't see the red reflex, it may indicate opacity, which may indicate a change in condition in the eye. Then I'll do the fundoscopic exam by using my, where's your right hand, sir? Right eye. Okay. So with this, I'm going to focus my ophthalmoscope directly into the eye, trying to visualize the arteries, the blood vessels rather, and also follow it until I see where it all meets the yellow, looking for the yellow-orange cup. And then after that, I would assess the shape. I'll also look for hemorrhage. I'll also look for exudate. And I will do the same exam on the left eye with my left hand, looking at the blood vessels. First of all, red reflex, blood vessels, looking for hemorrhage, exudate, or any abnormality in the eye. The next part of the exam takes me to the ear. We'll do inspection and palpation of the outer ear on both the left and the right. Again, we check for masses, we check for pain or tenderness in any spot, we check for lesions, visualize the outer ear, the trigos, and also look at the ear canal. And with my otoscope, beginning with the right ear, I'm going to pull it up and backward, looking at the eardrum, which is pearly gray, and also the malleus and all the other inner ear structures. And while I was examining, I was keeping my eye for any foreign object for obstruction. Pull the ear with the left hand, this is the left side, up and backward, up, yeah. Looking at the eardrum, pearly gray, so that's good. And there is no obstruction, no drainage, no exudate, and no tenderness as reported by the patient. The next part of the exam is inspection of the nasal passages. I'll have the patient tilt his head backward. And with my otoscope again, I'm going to check for patency on both sides, the left and the right, looking out for obstruction or polyps, also looking out for any excessive drainage and the change in color, which is quite good, and also the septum, and there is no septal deviation in the nasal passage. While examining the nasal passage, I have to, in addition to the color and drainage, also the contour of the nares of the nasal passage, which in this case was well visualized. The next part of the exam would include palpation of the frontal and the maxillary sinus. By putting my otoscope aside, I am going to palpate the maxillary sinus. No tenderness here. I mean the frontal sinus, which is right here. and there is no tenderness. Right here in the socket, the bony structure of the eye, no tenderness, and then the maxillary sinus as well. No tenderness as reported by the patient, and also I do not feel any abnormal structure. I think the part of the exam that I missed in the eye is the also observing the eyebrows. For the mouth and the throat, with my tongue blade, I am going to look at the structures in the mouth, and we'll be looking at the teeth, the dentition in the mouth, the oral mucosa, the color, check for hydration, and then I'm also going to visualize the tonsils, the pharynx, the soft and hard palate, and the tongue. I want to make sure that there are no lesions or masses or patches in the mouth. Okay, I'm going to have you open your mouth, sir. Yeah, so I lift up the upper, the lift up the lips and look at the inside of the mouth. It's quite clear there is no loose teeth. Open for me wider, please. And then with my flashlight, there's no loose teeth. Stick your tongue out. Okay, lift your tongue out. And then I'm also going to look at the underside of the tongue, which in this case I will just do for purposes of the exam. I can see that there is nothing underneath the tongue. Stick your tongue out small. And then with my tongue blade, I will push the tongue to the side and look at the soft palate, which is nice and pink, and there is nothing abnormal. The color is even. And I will ask the patient to say, ah. Yeah, and there we go. So I can see where the tonsils are supposed to be. I don't see any right now. Let me see, sorry. Okay, and then the uvular, the pharynx in the back, the hard palate looks good, no patches of redness or discharge. Next part of the exam would be assessment of the neck, which includes the cervical node, the lymph nodes, and the thyroid. For the cervical, for the neck, we'll ask the patient to move his head left, right, so that I can assess range of motion. Very good. Left, backward, and forward. Yeah, so there is no crepitus sound or any clicking. And then I'm also just going to assess the neck area for masses or tenderness or any swelling. And also visualize, inspect the tracheum for tracheal deviation. So we'll do a frontal visualization, and the trachea seems to be in the right anatomical position. Also just palpate the area. Then I will do a posterior visualization. Can you shift forward a little bit? And in this case, turn around like this. Yeah. In this case, I come behind the patient, lift the patient's head, and then full palpate the tracheal until I find the cricoid area, and palpate that to feel for any masses or any abnormal protrusion. And this part seems to be okay. From here on, we are going to do the examination of the lymph nodes. We're going to start with the preauricle, which is right in front of the tragus, and I will palpate that, and I don't feel any lymph nodes here. Then we go to the post-auricle, which is behind the outer ear, right next to the mastoid process, and I don't feel any lymph nodes. Then we'll do the occipital, which is in the back, the base of the skull, and I don't feel any lymph nodes. From then on, we'll go to the tonsillar, which is right here by the location of where the tonsils will be, and I don't feel any lymph nodes. From here, we'll go to the submandibular, which is right at the angle of the mandible, right here, I think, right here, yes. And I don't feel any lymph nodes there either. Then the submental is right here, close to under the chin area, and I don't feel any lymph nodes. Then superficial cervical, which is somewhere here, like the stenomastoid process, and I don't feel any lymph nodes. Then the posterior cervical, which is right the edge of the trapezius on the left and right side, I don't see any lymph nodes. The cervical or pre-cervical chain, it's deeper into the stenomastoid, so I can't feel that. And then the supraclavicular, which is deep into the clavicle, and I don't feel any lymph nodes there as well. And if there were to be lymph node, we'll probably be checking for size, symmetry, also check for hardness or pain or movability. From here on, I'm going to cardiovascular system, and we're going to do auscultation of the valves, beginning with the aortic valve, which is in the right second intercostal right here. Then we'll go to the left second intercostal for the pulmonic valve. Then we'll go to the left third intercostal for Eppes point. The left fourth sternal border for the tricuspid valve. And for the mitral valve, it will be the left fifth mid-clavicular interspace. About right here. I'm also going to do a measurement or inspection of the neck veins, and that's the JVP and the carotid. Quickly, I would measure the JVP where the paper meets with the ruler, right here. So lean back 30 degrees, about 30. Sorry. So first of all, I inspect the JVP and try to differentiate it from the carotid artery by pulsation, and then I'll have to measure the JVP, which approximately is about 4 centimeters to the on the right side. And on the left side, about 4 centimeters as well. I'm also going to do a examination of the carotid by listening for bruit. First of all, I'm going to palpate the carotid on the that's the left carotid, and then palpate the right carotid. Then check for bruit. No bruit. No bruit. I'm also at this point going to check for bruit in the temporal artery. Both the left and the right side. Okay, I'm gonna do the lower extremity pulses. Okay, we'll begin with the right dorsalis pedis. Lightly palpate here. I can feel the pulsation in my hand. I'm gonna also do the left dorsalis pedis, and this way I check for equality in the vibration of my hand. Then I'm going to do the right posterior tibials, which is right behind the bony area here, and the left posterior tibials. Then we will do the popliteal on the left side. Pull the socks down a little bit so I can have access. And then I'm going to do the same on the right side. Pull the socks down and I'm able to palpate the right popliteal. And then we're going to do the radial pulses. Good. And the radial pulse on this one. Good. Then the right brachial. And the left brachial. Good. At this point, I'm going to do the chest and lung exam. We've done the examination of the anterior and the posterior chest before, looking for, of course, any tender areas, and then looking for masses or any skin breakdown. And I'm going to do the anterior chest exam, looking for scars or piercings or any lesions. And of course, in this case, there is none. So I am going to do auscultation of the anterior breath sounds. Do the same for the back, the posterior part. Deep breath. Good. Deep breath. Deep breath. Okay. Okay. Last one. So we've done auscultation of the anterior, lateral, and posterior lung fields. The exam takes us now to percussion for consolidation, but I must first mention that after examining the lung sounds clear, there is no wheezes, crackles, or any other adventitious breath sounds. I am going to do now percussion for consolidation and also the tactile fremitus to find out if patient has any underlying lung abnormality. So with the bony area of my palm, I'm going to have the patient say 99.
99.
Okay.
99.
Okay.
99.
Okay.
99.
I'm going to do the same on your back. Go ahead.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Okay.
99.
Very good. The last part of the exam would be percussion of the lung fields. With this, I am going to end the exam, the physical exam.